Malheur County is taking a step back in the state's reopening plan. That'll take effect on Monday. Governor Kate Brown made the move because over the past month, COVID-19 cases in the county have continued to rise. She said this action is necessary to reduce the spread of the disease and to protect people. Our Joy Prechtel talked to medical professionals in Malheur County to find out what it's like there and what moving back to phase 1 will mean.
In phase 1 of Oregon's reopening plan, businesses such as movie theaters and bowling alleys will need to close down, and recreational sports, they won't be going on either, and pools will need to close as well.
We knew that this potentially was coming. We've been trying to avoid it.
Sarah Poe is the director for the county's health department. She told me she doesn't think these restrictions will make a big difference for the county.
I don't feel great about it because I don't think that phase 1 is necessarily addressing all the reasons why we see the cases.
But the governor's moving the county back to phase 1 due to the spread of the coronavirus. Malheur County has the 3rd highest case rate in the state. And in the last 2 weeks, the county's test positivity rate is 26%, which is much higher than the state average of 5.8%. The county is also reporting around 15 cases per day over the past 2 weeks.
We have to avoid crowds. We want people to wear face coverings, keeping distance, staying home with any symptoms or when quarantined. That's not debatable.
Some of the numbers come from the Snake River Correctional Institution, which is the state prison. As of August 9th, Malheur County reported 800 cases of COVID-19. 176 of them were from inmates or staff at the prison. That amounts to 22% of Malheur County cases. 78% of cases were still found in the community.
But even when you take them out, it still is an increase in community spread and really concerning across Malheur County.
It's concerning to Dr. Brian Kitamura. He's the head of the emergency department at St. Alphonsus in Ontario.
Without a doubt, the last several weeks, we've seen just a big increase in cases, young, old, everywhere in between. Not unusual to have, 5, 6, 7 patients a day that are coronavirus alone.
That number is around a quarter of the patients the hospital sees.
And I've never seen anything like that on such a prolonged basis in my years in medicine, where one diagnosis has taken up so many of our beds.
Another issue that Poe and Kitamura told me about is the fact that Malheur County is right across the state line from Idaho, and the state of Idaho has fewer restrictions in place than the state of Oregon. However, both of them are reminding folks in both states to continue to wash their hands often, social distance yourself when you go out in public, and remember to also wear a mask when you leave your house. Joey Prechtel, Idaho's News, Channel 7.